Dr. Leslie Boyer. I'm the medical director of the Arizona Poison and Drug Information Center, and I'm the director of something called VIPER, the Viper Institute, Venom, Immunochemistry, Pharmacology, and Emergency Response. We study venom. We study its effects on people, and we study what good it does for the animal that has the venom.
The New England Journal of Medicine is reporting this week on a study conducted in Tucson hospitals by University of Arizona researchers. The article describes the promising results of an antivenom used to treat children who become very sick with nerve poisoning after a scorpion sting. Dr. Leslie Boyer, medical director of the Arizona Poison and Drug Information Center and director of the VIPER Institute at the University of Arizona, was the lead researcher.
First, what we learned was that if you give antivenom to a child who is having a serious nerve poisoning syndrome, they get better quickly, typically within 1 to 2 hours and always within 4 hours. If you don't give antivenom to such a child, the syndrome goes on and on long beyond 4 hours.
Dr. Andreas Theodoro from University Medical Center, one of the hospitals where the antivenom was tested, says the treatment cuts down pain and hospital costs.
Every year we get several children admitted here to the pediatric intensive care unit because of the serious effects of a scorpion envenomation. Not only are there potentially life-threatening effects, but it's also very painful, very uncomfortable. Now with the antivenom, these children can get treated in the emergency room and in many cases go home just a few hours later.
To do a project like this, where we take a rare disease that's never been studied before, you gotta have a team that covers it all. From the stinger to the child in the hospital. That means I need experts in scorpions. I need experts in the venom of scorpions and its biochemistry. My team needs to have people who know how to take that, work with horses, and make antivenom. How to take antivenom and make it safe enough to put into human beings. How to look at a human being and evaluate whether he's sick or not. How to keep him alive in the intensive care unit. How to do the design of an ethical medical study. How to do the statistics that'll help you understand what it all means. How to write it up and publish it. Present it to the world and publicize it. My team has hundreds of people on it because this is such a big issue. One of the technologies we've had to use is an old-fashioned one, but it's still important. ELISA. Enzyme-linked immunosorbent assays are a great way to measure tiny quantities of stuff in your blood, like venom. One question I have is, how does the scorpion venom get where it's going inside the body? I know that a stinger puts it there, and I know that my patients have effects on their nerves. But if I only knew the route those molecules took to get from the skin to the nerves, maybe I could interfere before it got there. A second question is, if we used antibodies made in the body of an animal, antivenom, and put that into the veins of the person who had the nerve effects from venom, would having the antibodies bind the venom mean that my patient would get better? The last thing, but maybe in some ways the most important thing that I want to know, is how to work together on a project like this. Venom is in the tropics, far away from the United States. The people who need it, the manufacturers that make it, most of the scientists in the world who do this, are spread so far and wide around the globe that it's hard even to meet each other, let alone work together. How can we get across borders and across language barriers and across medical traditions to learn about a rare disease?